Hi, I'm Tim. You might recognize me from such triggers as a barium enema, shoulder, chest, patient safety, which wasn't really a trigger, and also sterile technique. I'm going to do a sinus series today on a patient, so I'm going to go ahead and grab them. Arsenio?
Yes. I'm
Hi.
here.
Hi.
Hey.
I'm Tim. I'll be doing your x-rays today.
Hi, Tim.
First off, looks like we're doing a sinus. Taking a look at your sinuses today.
That's right.
What's been going on?
I don't know, man. I just haven't been feeling well the last couple of weeks, and I got a bunch of congestion. I don't know what it is. I'm not book smart or anything, so I don't know what you can call it. So.
Okay. What's your date of birth?
7/16/1983.
And your last name?
Clevenger.
Clevenger.
Yeah.
Awesome. Is there any chance of pregnancy?
You're silly. Of course not.
Okay.
I'm a male.
Come on in.
All right.
Alright, so the first shot for the sinus series, we're going to look at a Caldwell. What's important on a sinus series is you want to do your best to have a perpendicular beam. So, but before that, I'm going to get the patient ready. I'm going to give him this gown. He's going to put it on like a regular jacket. Normally we do it the other way, but since we're coming from behind, we want to protect that area. I'm also using a 8x10, put it in lengthwise. I'm going to mark the correct side of the body, so I'm using my left marker here. That is the left side. The side's over here. Sometimes I mix up those right and lefts. Not like it's that important, but we're going to get the patient right up against the board. We're going to have him place his nose and his forehead against the board. I want to first off make sure I've got my OML perpendicular, so I'm going to just rotate his head down just a little bit like that. I'm going to bring it back so he's got a little bit 15-degree angle off of the board. That way I can keep my beam straight. I will be pressing a button here that would give me a light. That's not it. Oh, there it is. And the beam is going to exit the nasion, which is right here, kind of at the top of the bridge of the nose. Alright. I'll be using a technique of about, let's say, 80 at 10. Nothing too crazy. So I'm going to go ahead and center my beam a little better. You doing okay, patient?
Oh yeah, I'm doing great.
Oh, great.
Excellent.
Awesome.
I trust you.
All right. There we go. And shooting X-ray. Go. We'll go ahead and take out that IR, get it run. Come back in. A new, fresh 8x10 that hasn't had an X-ray on it. I'm going to place that one in lengthwise as well. Have the patient tip their head back. I'm going to want to create a 30-degree angle from the OML to the IR, and this is the Waters view. Alright, it's kind of like his chin and his nose will be touching the board. IOML will be 30 degrees. IOML is 37 degrees. Oh, 30 degrees. And my central ray will be at the level, I'll be exiting. God, I twisted it. Will be exiting the Cantillon. Fructose neutral compound. Vertical. Down. What the hell is that? Perfect. I will again be using a technique approximately 80 at 8, 80 at 10.
Go.
Go ahead and take out this IR. from Waters. I'm gonna run that. I'm gonna go ahead and put in a non-X-ray exposed IR 8x10, putting it in lengthwise again. And I'm going to move the patient into an LAO position. So he's going to put his left shoulder kind of close to it, whatever. And I'm going to move his head into a lateral position. All right, the true lateral. I want his interpupillary line to be perpendicular to the IR. It's very important that you don't have a patient who has a lazy eye, perhaps. That line would throw it off. So, gonna keep them right there, interpupillary line, parallel or perpendicular, I should say, to the IR. I'll be shooting my X-ray at about 80 at 10 to 12-ish, and putting my left marker into the field, making sure I have light in all the right places. It's okay if your marker gets into the back of the skull area, not really so much in the sinuses, and make sure your collimation's good. Collimation's kind of already set up and good here. Just want to make sure I get all the sinuses in that. So about 80 at 10 to 12. Go ahead and take out my exposed film and get that ran. Gonna go ahead and bring in my unexposed 8x10. Gonna go ahead and place that in there lengthwise. This is a tough position sometimes for patients. It's the submental vertebral or submental. It's the SMV.
You need to do this position. I mean, my sinuses are feeling better, but I guess if it's needed, I'll do the SMV.
Yeah, you're gonna do it because it would benefit the radiologist. It kind of gets the sphenoid sinus a lot better than some of the other projections.
Okay, I guess.
Yeah. So we're gonna have him tilt his head back. He's gonna scoot up in the chair as much as he can. He's a very flexible young man. He's gonna place his head right on the IR. Move it up just a tad. Oh!
I think I'm gonna need a knee X-ray after this.
I can do those. So, the central ray is going to enter about 3/4 of an inch anterior to the EAM.
Yeah.
So here we have his EAM right there, about 3/4 of an inch anterior to that. Shooting in the center of the patient just a little bit.
This is really uncomfortable right now.
I know, but it's necessary. It's necessary.
Yeah.
We just want to make sure that his glabello-alveolar line is perpendicular. So
Probably gonna need a
pretty
technique
good.
here.
So I'm going to shoot this one at about 80 at 12 to 15. Markers in the correct position, and I'm going to go ahead and take out my exposed IR.
Okay, can I rest?
Go ahead. Yeah,
Oh.
relax. You can relax.
Thank you.
Go ahead. Gonna go ahead and take a shot of the mandible. Same patient who started to complain of problems with his jaw. He'd recently gotten into a fight. Called his doctor. Doctor said, "Go ahead and shoot that up." So put it in order. We're gonna put in our 8x10. We're gonna put it in crosswise. Yeah.
The guy hit me right here, but it
Right.
hurts right here for some reason. Do you know why?
That's because the force kind of travels through the other side of the jaw. And
Also blew that part
it
out.
blew that part
interesting
out.
stuff.
Yeah, it is pretty interesting.
Wow.
But right now we're just going to kind of focus on all of it. We're going to get both sides
Gotcha.
of your
Great. I appreciate
mandible.
it, Tim.
No problem. So we're going to go ahead and place the position PA, or he's in position DP. We're going to get his OML perpendicular to the board. So we've got his OML right there. We're going to get that. Kind of like his forehead and his nose right against the board. Tilt it just a little bit. Our central ray, we want that to exit the canthion, which is just beneath the bridge of the nose. So we're gonna lift up our Bucky there. We're going to go ahead and put a marker, right side, or I should say correct side. I'm going to collimate down. We really just care about the mandible at this point. Don't really need a whole lot of excess. So I'm going to be shooting this at about 80 at 10. He's got his protection on there, and fired it away. Dude. Hopefully there was no motion on that. I'm going to take my IR. It's exposed. Go ahead and give that a run. Alright, good.
Good, yeah. Can I relax for a second?
Yeah. I'm going to go ahead and place in my fresh IR 8x10. It's going in crosswise. The next one we're going to do is it's an axial projection. We're going to get his AML, which is a Acanthian meatal line. We're going to get that perpendicular to the IR. You get that mostly by getting the nose and the chin against the IR. So we've got Acanthian right there. Perfect. We're putting our light. We want that to go right through the acanthion. Got my right marker on there. We're shooting all these x-rays at about 40 to 48 inches in general. I'm going to go ahead and shoot this at about 80 at 8. I'm going to come on over and get my exposed IR out. You can relax or pop it.
Great, thank you.
Yeah.
Great.
I'm going to get this. Got my fresh IR 8x10, putting that in crosswise. I'm going to put the patient in a lateral position, really. I'm going to have them as close to the board as we can. I'm going to actually put them in the LAO, get their head looking, want the interpupillary line perpendicular to the IR, just like it is right now. I want to have a 20 to 25 degree angle on the tube here. There we go. And I'm going to be shooting for just underneath the mandible. So I'm going to move the patient back just a little bit. We're going to go right underneath where one side of his mandible is, and we're going to get the other side, just lowering the shoulder just a little bit. There we go. I'm going to put a marker on the board. Make sure I've got this whole team in there. And shooting it at about 80 at 10. Alright, I'm going to come in, take out my exposed film, going to run that, come back in, 8x10, crosswise, going to rotate the patient around the other way, get him in a RAO, have his head turned, keep the interpupillary line perpendicular to the IR. And again, I'm keeping that 25 degree angle on. I'm shooting just underneath the mandible that is closest to me, focusing on the mandible that is closest to the IR. Taking a step back, shoot this at 80 at 10, boom, and he's done. Okay, we're gonna go ahead and take a look at our images for the mandible and the sinuses. So we'll go ahead and start with the mandible. Our first shot of the mandible here, it's the PA projection, and we're mostly concerned here with seeing the mandibular bodies on either side and the mandibular rami, making sure that they are symmetrical, equal distant from each other, and are about the same with that rotation. So that's the PA. Next we have our axial lateral. Here we're focusing more on the ramus or the rami of the mandible. They're elongated in this view so that we can get a good idea of what's going on in there. The last two are the the axial-lateral projections. On the axial-lateral, we're mostly focusing on the ramus as well. As you can see, this is the rami that is closest to the IR. That's one we can see best. There's the other one not superimposed, kind of thrown up with the angle that we put on it. So we got a good idea there. That's the right side of the mandible, the rami. And here we have the left side of the mandible, the rami, right here. Okay, this is the left, so we saw the right. So that completes our mandible series. And now we're going to look at our sinuses. The first sinus projection is the lateral. On the lateral projection of the sinus, you want to see pretty much all of it, so all the different sinuses there. You got the frontal sinus up here, the ethmoid sinus, your sphenoid sinus is back here, and your maxillary sinus is right there underneath. So preferably you want to make sure that everything's superimposed, the rami are superimposed, that the orbital rims are pretty close to superimposed. That's how you know you have a good lateral projection of the sinuses. Our next look at the sinuses is the PA projection, Caldwell method. You want to see the petrous ridges kind of at the bottom third of the orbits, and on the Caldwell we're mostly concerned with the frontal sinus up here, but you can also see the interior ethmoid air cells on the PA Caldwell. We have here the Waters projection. This is where we had the AML 30 degrees from the IR. That way we could keep a perpendicular angle on the beam. Sinuses in general, you want that perpendicular beam. So on the Waters, we're primarily concerned with the maxillary sinuses right around here. But we are also, hopefully we should be able to see the frontal sinus, and some of the ethmoid sinus can also be visualized in this view. Lastly, we have the SMV projection. The focus of this one mainly is the sphenoid sinus, with the exception of you can also do a Waters open mouth to see the sphenoid, but we just chose to do the SMV to see the sphenoid sinus here. It's anterior to the ethmoid sinus, which is up here a little more. So mostly focus on the sphenoid sinus, but you can also see ethmoid as well on the SMV projection of the sinuses. Big man in a little cup. Big man in